I am now live. Awesome. So I'm going to give some time for everybody to log in right now. While we're waiting right now, I'm gonna. Hey, Kate. Kate logged in. I'm just gonna give some time for everybody to log in right now to just see that we're live. Perfect. So we have, sorry, I'm getting distracted. I want to make sure all my stuff is ready. Second live of the Q&A series. So welcome everybody. It's so nice to see everybody. So as you're familiar, this whole series is really, the goal is just to connect with other rec therapists and other people that might be interested. I know a lot of people that are following are new grads, as myself, starting in the field, curious as to what everybody is up to, and just really exploring what other rec therapists have to share. So I'm going to give again just a little bit of time, and then I'll have Kate join us. I'll send her a request. So I think we should be good. So again, I want to be clear that as long as we're going to keep talking, but please pop in any questions you may have for Kate or for myself. But really this is exciting because I'm not familiar with working with adolescents at all, and let alone in health and behavioral services. So this is going to be exciting. So thank you so much for logging in. So I will see. I can just click on Kate. And let's see if this works. Hello, hello.
Hi.
How are you?
I'm good. How are you?
I'm good, thank you. Nice to meet you.
I am already having to redirect my dog like I warned you about earlier. So
Yeah.
excuse me.
Not a problem.
Come here, babe. Come on.
Everybody's fan of animals, so I think we should all be fine.
Yeah.
Oh my God.
Join the
I
line.
have hello. What's his name?
His name is Gary, like the snail in SpongeBob.
Oh my God.
Say hi,
So
Tina.
cute.
Say hi.
Oh,
Got our distraction.
I'm officially distracted.
Totally.
So adorable. Yeah, that shouldn't be an issue at all. Well, first I want to make sure, did I say your last name right?
You didn't, but that's okay. You were very close. It's Basile, like
Basile.
man.
Okay.
Yeah.
Okay. I knew, I was like, oh, I should have asked before I even said it. But I was like, oh,
I get it.
we'll figure it out.
Or Basile, Basile, everything. So that was perfect.
That's fair. I was like, I have to ask. So yeah, I mean, just for the people that have logged on, again, the Q&A, I don't know if anybody has seen the previous Q&A. I already have some questions that I have for you. But if anybody else has questions, just, that's where the comment section is for. Yeah, so thank you for agreeing. I think that it's awesome to just ask all the rec therapists. I've connected with so many just through this page, and just I find the line of work is so interesting. So if you could just explain, just tell me a bit about the clientele you've worked with, maybe a bit about your background or anything you care to share about yourself and your role as a rec therapist, that'd be awesome.
Yeah, so I've had quite a long journey. I actually graduated 5 years ago, so I'm kind of a vet at this point in the field. But it's so funny. I actually started off my college journey as an art history major and an art minor.
Okay.
I was always one of those kids where I'm like, I don't know what I want to do. I don't know what I want to be when I grow up, but I always loved art and I loved people. So I quickly discovered that that was not for me. So my second semester, my freshman year, the college I went to, Ithaca College, they offered a therapeutic recreation major. And I'm like,
Mm.
okay, this is right up my alley. I've never heard of this before. But I mean, my first job was working as a waitress in a retired community. So I loved
Okay.
it. I just knew I loved working with people. And I thought I was going to be with geriatrics my whole career. That's what I started off as my first official
Okay.
therapy job out of college after I got my certification. I got a job working as a rec therapist at a nursing home and a short-term rehab center. So it was out in Rochester. So a 2-for-1 deal. They had 9 floors of a nursing home, and then they were connected to a transitional care center. So anybody who had gone for short-term surgeries, lots of knees and hips, um, stuff like that. So that's where I
Mm.
started. I was there for almost a year. And then my journey kind of took me to Buffalo, New York. And surprisingly, not too many jobs were available at the time I was looking. And I just came across a job as a recreation therapist and behavioral health services at my last job called Baker Victory. So it's
Okay.
residential health care. Like I've never heard of it before, but really interesting. And I had my first interview, and it was described as a lot of after school programming. We work with youth who are in need of like mental health and behavioral health services. So it's residential. So they live there throughout the week. They go to school there, they get therapy. And depending on, what their home situation is, the goal is to get them to their transition point. So whether that's
Okay.
home, whether that's dependent living or another facility that maybe, they need more services. So that was kind of my role. So I did a lot of after school programming, and I was there for almost 4 years, which is crazy to say.
Oh, wow.
Yeah. And my clientele there was anywhere from 13 to 18. So that was quite different
Okay.
from adults to geriatrics that I was used to. And when they say, that mental health really gives you a tough layer of skin, they weren't kidding. um,
Mm.
Especially in behavioral health. Wow, when you combine the two, it can weed a lot of people out because it can be a very tough and emotionally taxing job. And you know, I
Right.
I was fortunate enough to experience a lot of incidences within my first few weeks.
Mm.
So anything from, challenging behaviors to a lot of verbal and aggressive actions from a lot of our clientele.
Right.
They kind of throw you to the wolves in a way. It's just like, this is our job. This is our role. We have to make sure that you can handle it and you can also handle the clients as well. So,
Right.
so that was, yeah, it was enough to, you know, inspire me to stay for as long as I did, and had an amazing rec team. And so, yeah, so it was just a lot of after school, a lot of
Awesome.
work as well. Um,
Okay.
yeah.
That's awesome. So was it how many, you were saying there's other rec therapists, so how many, like, how big was your team?
So I would say, so we really changed throughout the years. So when I first started, there was a team about 6 of us. So we had
Okay.
5 rec therapists and a music therapist, and then our activities director. So 7, I guess,
Mm.
um, full-time employees, which was really nice. And
It's a great team, yeah.
we had our music therapist hop on probably within the first 6 months of me working there, and she was an amazing addition to the
Oh,
team.
nice.
And we had an art therapist with us for the longest time as well. And it's just so nice to have so many
Mm.
different disciplines. And, we're rec therapists, so we're super holistic and we do a little bit of everything, but it's nice to have the concentrations and a lot of
Oh,
different,
totally.
super helpful.
Yeah, I love that because I think, yeah, you make a good point in terms of rec therapists. And so I've never, actually, there was one music therapist and one in my previous job working in long-term care, but I never, like, it was very like arm length, like we didn't really work as a team. Like she kind of had her directive of clients to go see, and that was it. So I find that as rec therapists, there's that expectation that we need to kind of be jacks of all trades, but like we're not. People need to know that there are differences between music therapists and art therapists, and
Yeah,
they have their specialty training for sure. So I love that you got to work with those specialized therapists because it's such a huge value. It's
definitely. Great to
awesome.
have
Hmm.
overlap of programs too. They're super,
Yeah,
it's like they do a lot of one-to-one sessions, but then when we do a lot of groups, it's like this is how we can tie in what the both of us do, and you can kind of see the difference. So
yeah. So do you mostly do kind of your own therapy sessions and like individually? Do you do combined therapy together? Like groups, individual? Like what does that look like for you?
yeah, so I guess I forgot to mention that I got a new job at the beginning of COVID, which was totally,
Ooh,
yeah, it was a total like one
exciting.
flip in my life, and I was just kind of to the point where I appreciated my job that I had those 3.5 years for what it was worth, but I was really ready to kind of just expand my horizons a little bit in
Mm,
here. And that brought me to another mental and behavioral health location. But I work in acute mental health services. So I work in a mental
okay.
health hospital. And so back at, I'll call them, so I worked at Baker. That was my last job, Baker Victory. And then
Okay.
I work at a Bryland hospital. So at Baker, we were more focused on the group dynamic. So we would do a lot of after school. So we did anything from intramural sports to arts and crafts, um, anything. And sometimes with the music, we would incorporate art music, or we just have anything from like karaoke nights to swimming. I'm a certified lifeguard, so like we said, we wear
Awesome.
hats. So, and now at this current job, so I work in a therapeutic activities department, and there is a big
Mm,
distinction coming from a rec department to a therapeutic activities. Some people are like, oh, it's just a name change, but it's like, well, the nature of the programming that we provide is just it's
right.
different. So we're acute mental health. So our goal is to get our kiddos out within 7 to 10 days, depending on what their situation is. So we really try to do a lot of the coping skills and life skills and wellness, and just meeting the kids where they're at, because we've got kids anywhere from, I think the youngest that I've had is 5 years old on a unit.
Oh,
So
wow.
yeah, so varying
Yeah.
ages,
Yeah.
varying intensities, and just you kind of meet them at where they're at. So we'll do a couple programs in the morning, and then it's run like a hospital, so you have to do assessments throughout the day as well. um,
Right.
but it's mostly our group work, and then they really do push having one-to-one interactions with our clients as well, because sometimes we can have as many as 20 kids on a floor, and they might not get that, their emotional needs met, because there's only a couple of doctors, and there's so many kids and there's only so much time. So they really do
Mhm.
benefit from that one-to-one interaction.
Totally. Oh, I love that. Awesome. I think we already have a question from
Oh,
Angie. So she asks, what is your favorite program you've created or provided for clients?
ooh,
So that could be either with your current job or previous job. Hey,
yeah.
Laura.
So at my last job, so where I kind of sorry, you can hear the squeaking from my dog in the background. It's distracting for anybody.
Do all the noise. He's too cute.
Not but so at my last job, I really kind of struggled putting the therapeutic portion into therapeutic recreation there. It was kind of a hard sell. They really,
Mm,
I know that we had really like, oh, I want to do the sports. I just want to do arts and crafts, or I just want music therapy. So when it came to, discussing different topics, a lot of them really struggled with that. So I tried to do a self care
yeah.
that went over well for the first couple of weeks, but then, attendance started to fizzle out, and it's different when you're on campus versus in a hospital, you're a unit. So, it's kind of more difficult to pick and choose where you're supposed to
It's
be.
true. Yeah.
So yeah, so that's probably one of my favorites. The one of my favorite things that we do currently at my job now is we do a lot of coping skills. And with a lot of our kids who come in with a lot of self-interest behaviors, they have to learn, what are healthy ways for me to move my body and, get out those urges. How do I keep my hands busy? How do I keep my body busy? So we do
Right.
a lot of like fidget toys and coping skills and just alternative ways to, fight those urges and, get those negative feelings out without harming themselves.
Oh, I love that. Especially at a young, like, let alone in acute hospital, but just in general for kids or anybody that should learn early on any healthy coping skills. Because I think there's oftentimes a misunderstanding of what's healthy and what's not good coping, right?
Right.
Um, yeah, but you do bring a good point, actually. I never thought of when you were working with like art therapists and music therapists, actually, of that gap in terms of being like, okay, well, what is recreation therapy then? That to distinct, like that distinction for sure. Because you make a good point in terms of if you're not a rec therapist, people might not even see that difference, right? Because I can totally relate in terms of a lot of my clients that come through the doors. They either have specific music goals. So I kind of try to take as many tools as I have to help. But yeah, so what did you find for anybody that might be in that situation as well, where they might be faced with that challenge? Well, not necessarily a challenge because it's great to be in that kind of team. But I guess as a rec therapist, what did you find that was beneficial to stand out where rec therapy could be appreciated?
Yeah, that's yeah, like you said, it's hard and you don't want to step on toes. That's like I think the hardest part with being so holistic. So if someone has a music
Mhm.
goal, I want to make sure we're super person centered. So I want to make sure that I'm providing for their needs and their wants and their interests because that's how
Yeah.
you're buying doing is if you appeal to them. So, but at the same time, that everybody has a role as well. So if, somebody says, well, I like to listen to email music, I'm not just going to do a group with them and listen to music and talk about the benefits of music because it's not my job.
Right.
That's my role. However, I will refer them to music therapy and say, hey, we've got a music therapist, and then so as far as making the distinction between our two roles is that's really a tough one. That's really something that I struggle with because we kind of
Yeah.
overlap. I feel like we overlap with OT and PT, and
Yeah.
it's been a challenge. So I'm having a hard time
Mhm.
answering the question. It is,
Yeah.
we are super holistic in recreation therapy. Although I love my job, love the name. Sometimes it's really off-putting. They're like, "Oh, rec, so we're just gonna play basketball and we're just gonna run around." And I'm just like, "Well, no, recreation means so much more than just the physical."
Yeah.
So I think it's just kind of showing up and like, no, no, I see you for who you are, and I understand that
Sure.
not everybody's journey is like the same. So we have to treat
Mhm.
people, you know, we have to see them for who they are in their treatment. So I think that kind of
Totally.
distinguishes rec therapy from maybe other
Yeah.
disciplines.
Definitely.
Yeah.
And I think it's that skill piece too, right? So if somebody's super passionate to music and that's all they want to focus on, okay, refer them to the music therapist. But if like you mentioned, if you're really faced with a lot of behavioral challenges
Mm-hmm.
and they might be want to work at different skills they're looking for, then we could use something completely different than music.
Mm-hmm.
Anything that kind of falls into the recreation umbrella,
Mm-hmm.
and practice on those skills for sure. But I think that's what I love about our field, though, is that it is like Angie says, we are person centered warriors. It's really feeding off of really what the person needs and not taking that to our ego sometimes. Sometimes somebody doesn't need a rec therapist. Sometimes they're just like, you need to, pass on the baton to the next therapist that's specialized in somebody's interest. So that's definitely a good point. Yeah, I love that. hmm So yeah, Angie actually asked my next question in terms of like main interventions and all. So I don't know if you have anything to add on that piece in terms of, because again, like I said, I'm not familiar working with that population at all, or even in mental health. So I'm kind of coming in a blind eye here. So um, I don't know if you have anything else to add in terms of interventions, but
Yeah. So
yes.
you can plan for the best week or the best day,
Mhm.
the best day ever. But like we have clients that show up, for 7 to 10 days. Some kids are there for 3 days. Some are there for like 2 months. It really just kind of depends. And, we might get a
Right.
wave of kids that are, have super self-injurious behaviors, or we just recently, so we have two groups of kids. We break up into group ones and group twos based on their age, and kind of where they're at. So for probably the last week and a half, we had a whole group of kids under the age of 10 with ADHD anger issues. So, like I said, it's kind of just meeting them where they're at. We do have different days throughout the week. It's usually the last couple of days where we have certain things, but as rec therapists, we know that you always got to have a backup plan. Not
Yeah.
everything's going to go according to plan. And so, if you plan like, oh, we're going to do this today, but say you have teenagers who, maybe are, they have a lot of self-injurious behavior, but they don't really have that
Mhm.
ADHD. You just got to be specific and meet them in the moment and say, hey, a lot of ADHD. We got to do some gross motor stuff. We've got to, talk about our anger. We've got to work on alternative ways to explore anger and how to deal with anger.
Right.
So as far as interventions, I mean, it's anywhere from talk therapy, talk things out. We keep it interesting. Like we have a lot of conversation balls that are all the kind of beach ball.
Right.
So we'll get that gross motor piece out of the way. It's like, okay, we're going to keep the ball up, and then whoever doesn't catch it has to answer a question, and they hate it, but they get something because they're,
Totally.
um, and the teenagers too. Teens are a tough crowd. I've worked with them for almost
Mhm.
5 years now, so you really have to, appeal to them, which is a whole other challenge in itself. Teenagers normally are tough, but teenagers are also
Yeah.
tough stuff, or it's a whole other level. So yeah, it's just kind of like I said, I keep repeating myself, meeting where they're at and what's going to be the most
Totally.
effective. Because if you're going to run an
Yeah.
intervention that's, they're not going to gain anything from it, you're just wasting everybody's time.
Totally. Oh,
So
that's awesome.
yeah.
So since it's young kids, are all children like, do they all have their parents with them, or it's just them admitted to the unit?
So within the admission process, which can take anywhere from 1 to 3 hours, it's a screening of questions. So the
Okay.
kids are there with their parents, and then it's kind of like residential. They're admitted to the unit, and that's where they stay. With
Right.
COVID, it's been super interesting because I'm coming from a job
Mhm.
where, I just ended my job and COVID just started, and then I'm starting a whole new job where everybody's wearing masks. We don't have as many services or regular routine things like visitation. Visitation was a
Right.
huge thing especially for our younger kiddos who, this might be the first time that they're away from their parents and they don't know how to cope with
Mhm.
that, let alone feeling I did something wrong, I'm in trouble, but I can't always talk to my mom and I can't see my mom, so yeah, that's been a really tough one.
Interesting.
Um, we're
Yeah.
visitation back, and with COVID, that we have our own struggles with making sure that visits are therapeutic, but also safe for everybody that's involved as well.
Definitely. Yeah, that's definitely a big curveball. I think we've all unfortunately had to figure out. I do want to add, though, I know we had more people join in. So, again, feel free to add more in the comment section. If you have more questions, just feel free to ask if we haven't answered them yet. But yeah, you bring a good point because for parents, because for me at my job, where I work with adult inpatients with physical and cognitive disabilities.
Mm.
But you know, we get pediatric clients too sometimes, or people that are older, not to be considered pediatric, but let's say like 16. So anybody below the age of 18, they have a parent with them.
Okay.
But what's interesting, that hadn't changed during COVID. So the parent had to stay in the room, masked, couldn't leave the room. So it was up to the parent. Okay, it kind of worked for parents that were, had another partner, but I just can't imagine just kind of that decision for a parent either, to just be like, okay, I can't, like, either I can't stay, or I have to stay and figure that out. But definitely that piece for a kid that can rely on a parent so much. I can definitely imagine that being difficult.
Yeah.
I think Megan has a question for us, for you. So can you speak a little to trauma-informed care and how you integrate it within your programs? That's a good question.
So trauma-informed care. So essentially knowing that everybody's been through something and every behavior has a purpose and every reaction has a purpose. So within our program right now, we like to make sure that we set our expectations for, we're all here to get well. We're all here for a reason. However, I have a coworker who introduced this amazing analogy during one of our groups. So we do a therapeutic drumming group, and during one of our groups, we go around and we ask a lot of therapeutic questions. And I can't remember the context of the question, but somebody mentioned something about abuse that they had endured growing up as a child, and one of her peers had a very negative reaction and kind of at her. But she's like, "Why would you say something like that? That's not okay. Jump, this and that." So she had a very, very powerful reaction to something, and she just met this girl, so neither of them knew each other. So my coworker came up with this amazing analogy. So say I have a peanut butter sandwich, okay? I'm coming into class. Chelsea, hey, what's up? And then you say, "Oh, I'm allergic to peanut butter. Please, can you not bring that peanut butter sandwich next time you come to class?" And be like, "I see you. I hear you. I'm so sorry. I will not bring my peanut butter sandwich next time I see you." So I've known that you're peanut butter, right? So I will be informed that, hey, you're allergic to something, or something's not sitting right with you. So I will know for next time not to bring my peanut butter sandwich to the group or to class. So it's the same thing with trauma-informed care. You have to be aware that, everybody's been through something. Everybody's got trauma of some type. So you have to be trauma-informed and trauma-sensitive. We try to make sure that within our groups, we say, let's make sure we're keeping things appropriate for group, and let's not, let's be aware of other people's triggers and other people's sensitivities, because, what your peanut butter sandwich might be, might not be somebody else's peanut butter sandwich. So.
I love that. Yeah, that's a good analogy for sure. Yeah. Thanks for that question, Megan. And my favorite question, I think I'm going to ask everybody about this, for research, because I have a researcher that reached out to me to ask this question, and I need to ask it. So, but yes, yeah, definitely being sensitive to each other's triggers. I can definitely imagine with with children, because they're still learning their social skills. They're still trying to figure out what's appropriate, what's not, and, add on their, any mental or behavioral challenges they're experiencing. I work with adults, but, you still see that. You still see that sometimes it might not be lack of sensitivity, but sometimes just that unawareness of how to deal with, it can be awkward, right? If it's something that's triggering, it's like with Kate, with my first Q&A when we were talking about death, it's such a trigger for some people, and it's like, it's awkward. I don't know how to address it. So then somebody just kind of can approach it in a really, not a socially acceptable manner, if you will, right?
Definitely.
But yeah, that analogy was awesome.
And we do our too in trauma informed care to never really chastise or if a kid makes a mistake because they're not informed, we try to educate. We try
Totally.
to because that can be traumatizing as well. If somebody just doesn't have the information and then you're yelling at them in front of the group, that could be part of you know, their narrative.
Yeah.
So it can trigger things in them as well.
And it's so important, and that's why they're in a therapeutic in a not situation, but like in yeah, situation, I guess. I feel like there's a better word, but I'll probably remember it. In a setting, that's the word, therapeutic setting. Because yeah, I can only imagine that heaviness and even a caregiver trying to having to try to deal with that, right?
Mm-hmm.
Um, but yeah, actually, I'll ask the research question and then I like Megan's question as well. So if someone can conduct a research that would benefit your practice, what would that be?
Ooh.
Because I know for me, a lot of the times I'm like looking at my computer, typing like for an intervention, and then there's no backed up research.
Yeah.
And it's like, oh, I feel stuck.
Huh. That, I mean, gosh, we cover so many
Mm,
different things, and I'm very fortunate enough to work on a team with like wonderful clinical counselors or social workers, and we have occupational therapists as well. So I might have to think about that and come back.
definitely.
Just
Yeah.
because we've touched upon a lot of different things, and I'm just trying to think of my current clientele and, just seeing the patterns that we're kind of seeing,
Mm,
with reasons why kids and adults are all coming. Because we have an adult unit as well that I bop around from floor to floor, and do programming with them as well. So yeah, I may have to come back to you on that.
yeah,
That's
definitely.
a great question. I should have thought of that before
I
the
know. I
conversation.
could have sent it to you, yeah.
Mm-hmm.
But for any future people joining on Q&A, that will be a question. So think about it. Um, but yeah, definitely the hey Anna. Just saying hello to people as they join in. So yeah, Megan had a good question because given that where you work is really emotionally heavy environment, do you
Mm-hmm.
have any self-care or caring for the self tips for others working in that same environment?
My biggest advice would be don't take your work home with you. That is
Mm,
one of the hardest lessons, and I think it took up until probably a, a little while into my second job to not bring the emotional weight of other people's struggles home with me. It's hard when
yeah.
you're somebody who has an amount of empathy, right? I have a lot of people that I work with that identify as empath, and I've worked with some people that this is their first job, and they're just like, how do you do it? How do you go home,
Yeah.
think about it, and not worry about it and ruminate on, I should have said this different, I should have done this different.
Mm,
That's one of my biggest advice is, you do what you can, with what you have in that moment with this person. And then you've got to take care of yourself before you can take care of anybody else. I mean, it's as cliche as it sounds, it's so true. You know,
yeah.
you're the number one priority and you got to practice what you preach. And I find that even in therapy, I have a hard time doing that. And I got to check myself on it because sometimes I don't even believe the words that are coming out of my mouth because
Mm,
I try to give advice, but I always follow for myself. And, those are good days where I kind of take a step back and think, have I done anything that I enjoy? Have I, done the things that are healthy for me instead of just coming home? And, I've got a wonderful dog now who helps me, kind of regulate my schedule throughout the day, not just sitting at home, wallowing in like the emotional after
mm,
effects of the day, sitting on my phone or watching Netflix, just kind of
yeah.
getting out of we challenge all of our clients to try new things, get out of your shell, do the things that are important to you, because that's where
Right.
a lot of our admissions, a lot of the people that come in, they're really struggling with COVID because they're getting an abundance of free time, or their free time was filled with all of these things in their communities or in their schools that they're not able to have access to. And that's really weighing on them. And that's really depression and anxiety, all those really spike. So yeah, it's just a lot of practicing what you preach and keeping work at work, because you can't
Yeah.
change anything, and by worrying you're only hurting. So
I love that. Yeah. You bring really good points. Because I think I can, obviously, I can really relate to that. In terms of like not bringing work at home, one thing that I know I did for that was I had my work email on my phone.
oh no.
And I don't know why. I really don't know why. Because as you say, work needs to stay home. Stay home. Needs
Keep it out.
needs to get the hell out of the home. But because yeah, I mean, I think any rec therapist can relate. I mean, we're obviously caring. We definitely have a piece of caregiving in our personality if we're really doing what we do. So definitely take that work email off your phone.
Yeah.
But routine is huge, and I know COVID has definitely flipped everybody's routine upside down, pretty much. But I love that, is really reminding yourself, like, okay, what can I try? Like, what can be new? What can my routine look like? Because it's so easy to wallow and absorb those, there are difficult situations definitely to absorb. So try not to absorb any of that for sure, and releasing it in any way possible.
Bring yourself
Yeah.
out with fun at the end of the day. Just leave it there.
Yeah. Love that. So Jasmine mentioned she missed the intro, but she said, "Oh, do you work with ABA therapists?"
Ooh, so I don't closely work with any ABA therapists, but one of my close friends that I grew up with, she used to work in a school with the DD population, so developmental disabilities, and they use ABA therapy all the time there. She was a teacher's aide, and that was so applied behavioral analysis. I'm assuming that's what you mean. So it was just interesting to see how, I worked with quote unquote typical students with behavioral issues, and she worked at a school for anybody on the autism spectrum who also had behavioral issues. And it's interesting. We had a lot of amazing conversations about, again, every behavior has a purpose, but our interventions looked a little bit different. So they use a lot of ABA therapy. So, if someone's not doing something right, correct me if I'm not sure who asked that question. But it's allowing them to know that they've done, like, this is incorrect. Why don't you try it this way? Okay, try again. So it's the notion of understanding where, you have not done something correct. I don't want to say haven't done something correct, but giving yourself the opportunity to try again and to learn from things. So I'm hoping I'm explaining that for, the amount of conversations that I've had, that I kind of gathered ABA. So it's kind of like a pattern. So ABA. So, try again. So, but I wish I would really love to learn more about ABA therapy. And we're just slowly starting to integrate more specific therapies into our practice. Like, we're just getting trainings on CBT, so cognitive behavioral therapy, dialectical behavioral therapy, and hopefully down the line it can be a hospital-wide initiative, so it's that in their basic training when they come into the hospital. So many different therapies, and I would love to learn and use them all, but they all have a purpose.
Totally. Yeah. Oh, that's awesome. So I hope that answers your question, Jess. No, that was great. And yes, So an intervention that's evidence-based for the population you work with that that you'd like to try but haven't tried yet. Is
Hmm.
there anything that you can think of that you've always wanted to try but
Huh. Well, I think with the DBT, I was super fortunate at my last place to have had a training in the DBT therapy. And I know that a lot of clinical counselors are able to use that in, one sessions and, smaller group settings. So I think I am slotted to be in a new training that's coming up in the next month, so I'll be able to learn a little bit more and hopefully learning how to apply it in the hospital setting and even just educating the staff on the floor how to utilize
yes.
EBT skills as well because I'm fortunate enough that I have an office to kind of escape to when I'm doing my programming or I'm done with assessment, done for the day. But being on the floor the whole entire time of your shift can really kind of weigh on you and you kind of forget
Mm,
and your emotions build up and maybe our interactions aren't the best with the kids and that kind of has to create more behavior, just educate staff more, for self-care because that's super important. You got to take care of yourself,
totally.
and that's just communication skills, because
Yeah.
you snapping at a 7-year-old because you're frustrated with them, in the moment, might do something, but down the line, it's not going to teach you or the client anything. So,
Totally.
yeah.
I love that. And so for the training, is that something that has come up just in your workplace that your manager just offered for you to partake in? Or is that something that you had to bring up as an employee?
No, so it was offered, our clinical
Okay.
counseling department brought it up, and then they offered it hospital wide. Slots were limited, so that was kind of their first trial run
Right.
last. So I'm fortunate to have that experience in the background, so I know a little bit about it. So hopefully they'll just
Right.
upon my knowledge that I already have.
That's awesome. Yeah, because I mean, I'm privileged enough as well to be in a place where, education is valued, like continuing education. So I know, unfortunately, I know some places it's not as valued or they just don't have the funds. So it's just, it's always a question I'm curious to ask other therapists too. Like, if there's any other rec therapists watching here that, either have struggled, accessing training or, just comment what has worked for you or because advocacy obviously is always strong in our field. But it's always nice to be in a place where they definitely value continuing education.
Definitely.
You know, at the end, it's not a selfish act. You're doing it for, valuing your therapies with your clients for sure. Yeah.
Absolutely.
So we're a little past half an hour. I don't know if you have time just for
Yeah.
last couple questions.
Yeah. Great.
Okay. I'm like, I don't know why I put the 30-minute mark. I'm like, I'm just gonna pre-book it for an hour for my next
Oh,
session. So easy to talk. Yeah, I mean, we kind of touched base on it a little bit, just how COVID has changed things a little bit. So I don't know if you want to touch on how you've adapted through COVID, either professionally or personally, whatever you really want to touch base on, because I think anybody can relate on all those levels.
100%. Yeah. So
Yeah.
COVID started kind of at the tail end of my time at my last job. So we were truly in a panic, which is not the word you want to use for when you're working in
Mm,
care services. And it was really I mean, it was challenging for everybody, but for us to for everybody to be on the same page, you know, there was a lot of people at each other's throats, not understanding, like,
mm,
I'm frustrated and I'm frustrated. We can't come to a mutual understanding because we don't know what's going on. And, it was just kind of it was a very hectic couple of weeks trying to acclimate to, the new normal. And,
right.
everything could change overnight. Everything could change with within a couple of hours. So, I'm very fortunate to work in a department that was very vigilant about, you know, maybe our company wasn't supplying us with, you know, masks and hand sanitizer, you know, but we're ready. We had one of my very close coworkers was amazing with the sewing machine, and one of our programs was creating masks with the kids. A lot of kids
Oh,
wanted to
nice.
use the sewing machine. So at first it was kind of like pulling teeth to get them like, no, like we're gonna learn a new skill, we're gonna do this. And then by the end of my time there, everyone's like, can we make a mask? Can we make another mask? Like, we love this. This is so much fun. We're like, okay, like that's great. So but yeah, and as far as coming into my new role in the hospital, you know, I've heard of all these amazing services that the hospital provided that they kind of took down. First it was the visiting, and then for our religious book, it was different Bible studies that would come in, because religion is super important, you know, no matter what setting you're in. We had anything from massage therapy to pet therapy. So all of these different things that I heard about, I'm like, oh man, like I missed all of those. Like, and we still don't have all these services back. We're slowly starting. I think we just started massage therapies coming back. Even visiting is limited to one person per client. So you can have only your time at the hospital, which is challenging for, you know, especially if you're young and you want to see your mom and dad, but you can only have one come in. So that's been, even with the adults too, who are very vocal about their needs and advocating for themselves, that's been a huge challenge as well. But I was very fortunate enough to come into a hospital where you get a mask every day, get your taken right at the door. So
Right.
of comfort knowing that, you know, they're taking it very seriously. I mean, they have to. I mean, we are a privately owned hospital. However, it is a hospital nonetheless. So, you know, just taking those precautions and knowing that, you know, every day I'm going to have a mask when I come in is just, it makes you feel a sense of relief, you know, walking through the door, because, you know, stepping outside of your house can be a risk still. So,
Definitely.
and as far as personal, you know, it's just kind of, I don't have a lot of family that lives here. A lot of my family lives out of state or out of town. So as much as, you know, I miss them, I feel fortunate that I don't have to worry about, you know, to contact with them or, you know, make myself nervous, especially coming from the hospital. You know, it's nerve-wracking as it is, but, you know, I have a lot of older family members, and I would never want to, you know, as much as I miss them, I'm kind of glad we have more social distance than, you know, we could want. So
Definitely,
so as far as just
I love that.
finding that time for that self-care, and you know, like when the gyms closed and then sports ended, you know, that's been a huge part of my life as well. So, you know, the COVID-19 is a real thing. So just trying to get back into shape and finding that inspiration to, you know, to put on those workout videos or go on a run, you know, I think that's been a hard challenge, is finding that motivation. You know, like our clients, they just don't have any motivation to do anything. I'm like, you know what, we are very similar, you know.
No, we can all relate, definitely.
Yeah.
But I love how you shared in terms of like, for the mask making, like turning a necessity into, you know, a therapeutic activity, in terms of just, I mean, that requires a lot of skill and attention, right? And patience. So I love that. Yeah. We have a fellow occupational therapist with us. Hello, hello. So he asks, you kind of touched base on that actually, just talking about how you've coped, you know, personally in terms of where, you know, sports and being active is important for you. But do you have any favorite leisure activity?
Any favorite leisure? I would say Netflix is a big one, but I love reading. I'm slowly starting to get back into reading. Again, it's the challenging myself to do new things. I did a book club for the first time in my whole life, and that's been really fun to actually started looking at the books. I'm a chronic book starter, and I just like to start new books every 5 minutes. So
Yeah.
it's really challenged me to stick to something and have that concentration and that focus. So,
Yeah.
but other than that, just I very fortunate to love oh
Connection. Are we good? Can you hear me good?
you yep, I can
Yeah.
hear you.
Okay, great. But yeah, I started a book club too because, and it's funny now. I'm like the same thing. I've been wanting to like start a book every other day now, so it's pretty nice when you start new things for sure. And
Definitely.
then Annalisa's asking, do you have any other certifications? So crisis intervention or with other therapies?
So currently I only have my CTRS, so my Certified Therapeutic Recreation Specialist certification. Um, but when I was at my previous place of employment, our therapeutic intervention was TCI, Therapeutic Crisis Intervention. So I actually still work there per diem, so I think I technically still have that training. And then
Awesome.
you come into the hospital, you learn a new form of crisis intervention. It's just called something different, and the name is escaping me right now. So, but it's more based on working on de-escalation first, because the last
Right.
intervention that you ever do is put your hands on somebody. That should be the last intervention that you think of. So,
Yeah. Awesome. And I think I'll finish off with, I mean, you touched base on, self-care advice, but in general, any piece of advice for anybody who's looking to start working with this kind of population? Do you have any, pieces of advice for that field?
yeah. So don't take anything personally. I,
Mhm.
being a sensitive person, had to learn that very quickly. Because somebody calls you a name, says something mean nasty to you, doesn't mean it has anything to do with you. It's something that they're going through, and you kind of have to take it as, so never take it personally. Um,
Mm,
I think that's my biggest piece of advice, and like I said, practice what you preach, because no one's going to believe you if you don't believe in yourself and what you're doing.
yeah.
So I think those are my big piece of advice. And if you're in mental health and you're going through, some tough times with some tough clients, like stick it out. And if it's truly not something that's for you, I mean, the mental health, there's a burnout, and some people, it's their whole lives and they're super passionate about it. But if it's something that you're finding that you're burning out quickly, you're not very passionate about it, then, your services are probably much better used elsewhere, because mental health it's super emotionally, it could be physically taxing as well, depending on what population you're working with, or what
Yeah,
environment you're in as well. So yeah,
definitely.
pieces of advice.
Yeah. Yeah, it's so true. Clinician burnout is real. So definitely any clinician, my motto, especially during COVID, has been, you can't give from an empty glass. So my goal throughout this whole thing, that's been motivating me, has just been like, okay, fill your cup, fill your glass first, because we give a lot throughout the day. And I can only imagine, especially, mental health is difficult. Just being a clinician is difficult in itself, right? I don't think I'll say this probably every live, we don't give ourselves enough credit for everything that we do. So I love hearing from other rec therapists, and thank you so much for your insight and sharing your knowledge, because I definitely learned a lot. And I hope everybody else did too, which I am sure. But yeah, I'll definitely save this live, so I'll be posting it for sure. But is there anything else you want to add, or we are good?
Everybody just take care of yourselves, mind, body, spirit,
Mhm.
everything. It's all connected. Everything impacts the other. So I'm slowly starting to remember to practice what I preach, and
Yes.
that's one of the big things is take care of you, but take care of all of you. So.
I love that. Yes, ditto. So thank you everybody for tuning in.
Thank you
Second
so much for
series, well done. Thank you for agreeing to do this and taking an hour of your time. So I appreciate you doing this. So
I love it.
many thanks. And again, feedback is really appreciated, everybody. So reach out to me, questions, comments, feedback. Here for you. So
Same
thanks
here.
again.
I'm private, but I'm always open. So let me know if you guys have questions.
Yes, I'll redirect them to you.
Love it.
Great. Thank you so much.
Thank you.
Take care, Kate.
Bye.
Bye, everybody.